Women today wear different hats, which comes with different responsibilities. So, as we celebrate National Women's Month, we'll take a closer look at ways we can understand the health issues every woman should be aware of and the best self-care tips for women today. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. Our guests are here today to tell us how we can be a part of this movement and advocate for women's health. With us is Dr. Irene Sige. She's an obstetrician gynecologist from Cardinal Santos Medical Center and the St. Luke's Medical Center in Global City. Also with us is Natalie Africa Verceles, who is the director for Center of Women's and Gender Studies from the University of the Philippines. Thank you both for joining us here on MedTalk Health Talk. Now, there are several prevailing beliefs about women that can have a direct effect on their mental health as well as their physical health. But first, let's debunk some of these misconceptions. So let's start with the misconception that women are solely responsible for home as well as family. Ms. Natsi, could you talk more about this and this notion, and how does it affect the women of today?
Yes, Doc Freddy. That's actually a reality, not just in the Philippines, but across all countries of the world, perhaps. No, it really stems. The roots of this belief is what we call the theory of biological determinism. Just because it's women who are able to get pregnant, give birth, breastfeed, automatically it's assumed that they are naturally more caring, more nurturing, more patient, more altruistic, which results in them being assigned the bulk of what we call reproductive work or the care work that women do in households. We know that the work that women do in households is not easy. It's actually quite onerous. It deprives them of many opportunities.
I agree with that. So one of the main issues here is that of gender equality. So how can this be addressed, Ms. Natalie?
It's not necessarily the burden only of the women, because you think that it's women who should be advocating for their own equality in the households. It actually demands the participation of all other members of the households, particularly the male members, whether it's the father or the brothers, etc. So what we should be doing is actually redistributing the work that women do in households. Fathers in particular can take a greater role in caring for their children, particularly when they're very young, when they need more attention. So that's one way, and it's very actionable, is it not? I mean, men can just simply offer to assist women and to ask them, what is it that I can do to make your household chores easier for you?
Do you feel that we've moved forward with this? Because nowadays there's less of a stigma with the husband or the male person of the household taking care of the child or doing things that would be commonly deemed as something that is solely for the woman to do.
No, I find that among the younger generation of men, it seems more acceptable for them to take on more work in the household as compared to men from the older generation. But I'd also say it's very key that you pointed out how important the household is, because it is really the most basic unit of society. And if we want to promote gender equality, we should start in our households. And mothers in particular can raise sons who understand that it's not necessarily solely the task of women to do all the work that's necessary to maintain households.
Along these lines, we'll also be talking about some health issues that women should also be aware of. Dr. Irene, what are some of the top 5 health issues that you think women here in the Philippines should be really aware about?
Right now, we are encouraging more on preventive medicine rather than curative medicine. The common ones like diabetes mellitus, hypertension, obesity, some sexually transmitted illnesses, breast cancer, among others, and also mental health issues.
Those are very important ones, and we'll be discussing them in further detail as we go on in the program. Ms. Natsi, let's talk about the landscape where women are, especially here in the Philippines. What can you say about that? What are some of the challenges that women nowadays face, especially in the workplace?
When we think of the workplace, we automatically think of an office, do we not? It has shown that the labor force participation rates of women are 28 to 32 percentage points lower than men's, which means that there are less women as a percentage of women who are of working age, who are in the labor force. So that brings us back to what we were discussing earlier about how women are still seen as primarily responsible for domestic work.
Dr. Irene, talking about pregnancy and maternity, especially in the workplace, is there a certain time where it is deemed safe for her to continue to be working, or should she be resting at a certain point awaiting the birth of a child?
As we always recommend, having children or getting pregnant should be a plan ahead so that the mommy can prepare herself physically, psychologically, mentally for the pregnancy. So actually, pregnancy is not a disease. It's a physiologic role of a woman. So when she's planning to have children early on, she should be already consulting her doctor so that her pregnancy will be less complicated. The woman can actually work until the term pregnancy as long as she's considered low risk. However, if during the prenatal course, there's comorbidities like diabetes, hypertension, obesity, which will be determined in the prenatal checkups, appropriate recommendation on when to do bed rest, when can they go back to work will be recommended by their OB-gynecologist. So the emphasis is on proper preparation before pregnancy, during pregnancy, and after delivery.
That is definitely an important factor, especially for first-time mothers. Now, National Women's Month is a time to celebrate women's achievements, but it's also a time to raise awareness on issues unique to them. There are several health issues that impact women differently than men. When we return, we'll talk about these health concerns and what women can do to manage the risks. You're watching Med Talk Health Talk. We're your partner in health. It's no secret that women have unique health issues that only women experience. Now, understanding these medical conditions, the risk factors, and prevention can boost a woman's own health as well as their mental health. I'm Dr. Freddy Gomez, and welcome back to Med Talk Health Talk, where your care always comes first. A common issue women face as they age is osteoporosis. This is when your bones become weak as well as brittle. Now, postmenopausal women are at higher risk for fractures associated with osteoporosis, and as a result, it can cause back pains to posture and even broken bones. Dr. Irene, could you tell us more about this condition and why women in particular are more prone to this?
You are right in saying that osteoporosis is a disease condition wherein the bones become weaker. There are several factors, like when the woman becomes menopause already, because of the lower estrogen production in the body. This will trigger the bone resorption, or the bone will become weaker. And also if the woman has not maintained her ideal body weight or the body mass index, because it will have an effect on the weight-bearing bones of her body. And not having regular exercise, and also not getting the proper nutrition, the intake of calcium. And also important is the exposure to sunlight, because it activates the production of vitamin D in the body. And other medications are also causing osteoporosis. So it's important that they have to consult their family doctor to assess their risk for osteoporosis, especially when they're 50 years old and above.
Now, another health issue really prevalent in women nowadays is breast cancer. The data from the health department shows that 3 in every 100 Filipinos will be diagnosed with breast cancer in their lifetime. Women with breast cancer often experience a predictable set of emotional as well as psychological reactions to their diagnosis. Ms. Natsi, what are some ways that women can deal with the anxiety and stress of worrying about a diagnosis of having breast cancer?
It's so important to have a support system, because it's not something that you have to go through alone. And I find that women usually rely on very close family members or friends to help them through it. Because I think when you go through a devastating diagnosis and you're facing a threat to your life, I think you really need a lot of, well, not just support, but a lot of internal strength. It's very important for women to feel that there are people they can turn to. You know, it also relates to how families should be more supportive of women. So hopefully in the household, we will have fathers and children understanding the plight of the women and doing what perhaps is necessary to unburden women of their responsibilities they carry on a day-to-day basis.
One of the leading causes for depression for those with breast cancer is they claim that they lose part of their womanhood when they undergo surgical operations that need to remove that cancer. How can we uplift women who may feel depressed because of the need to remove certain parts of their body?
Yeah, that's a very interesting question that relates really to the larger issue of how society objectifies women and sees women principally on the basis of their appearance. So for women to internalize that and lose what they feel is an integral part of their being is also devastating. As a culture, stop prioritizing beauty, start valorizing what is not considered as essential. People are more than their appearance. So for women to realize that a breast is just a body part and it does not take away from who and what they really are as humans.
Now, Dr. Irene, let's touch on STI, sexually transmitted infections for that matter. Could you talk about what are some of the risk factors that are involved here? How does this affect a woman specifically in the long term?
Gynecological health of a woman really depends on the entire physical well-being of a woman. So to avoid sexually transmitted illnesses, of course, we emphasize on monogamy or monogamous relationship because this starts from having sexual intercourse with multiple partners. And there are some protective measures that they can do when engaging in sexual activities with multiple sexual partners, but that should really be discouraged. There's condom or barrier methods and use of oral contraceptive pills.
Ms. Natsi, when it comes to the choice of who should be using contraceptive, is this based on a cultural nature or is this more of a 50-50 decision on who will be adhering to that contraception?
I will insist that all women of reproductive age should have access to contraception if they so desire. Because we want to prevent unintended and unplanned pregnancies, particularly for teenagers. And as Dr. Irene already mentioned, there are also barrier protections because we want to protect them from HIV/AIDS or sexually transmitted infections.
Dr. Irene, I want to talk about menopause, how to decrease the symptoms that one may experience when they are approaching menopause or at menopause.
The symptoms of menopause are as follows, like you have irritability, hot flashes, osteoporosis. Sometimes there are abnormal bleeding and insomnia. So again, it starts with a healthy lifestyle early on. Even before a woman reaches menopause, they have to be physically active. Again, proper healthy diet, proper physical activity, and you have to consult your OB/GYN for other comorbidities that you have so that this will not aggravate the symptoms of menopause. And there are some high-risk diseases that can set in once you are menopausal.
Taking steps to prevent health issues is a great form of self-care. When we return, more self-care tips for women. Your health is our mission here on MedTalk Health Talk. Many things can get in the way of caring for yourself, like work, school, or maybe even family obligations. But when we take the time to care for ourselves, we're able to show up for others at our very best. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. One of the most effective things women can do to care for their physical health is regular screening. Dr. Irene, how does regular screening empower women?
We have to do this regular screening for breast cancer, for cervical cancer, for other gynecologic pathology, and for the physical well-being of a woman. Right now, we are recommending a pap smear for those women who are at 21 years of age. And if they are 30 years old and above, they can do this with co-testing for HPV virus. And beyond 50 years old, it can be every 1 year or every 2 years, depending on the results of the previous pap smears. But they should be consulting their doctor, because some women just, get information from their relatives, from their friends. And so these are unreliable information, because this will help them detect early sign of cervical cancer. Now, for breast cancer, if they have risk factors like family history of cancer, early menarche or late menopause, late childbearing, above 30 years of age, or haven't had children, and intake of hormones or HRT, this will make them at risk for breast cancer. So they should be educated on and counseled on these women's diseases and be aware of the possible symptoms of a breast cancer. And for the other health issues such as diabetes, hypertension, just recently there are executive checkups, especially for working women. There are different panels of metabolic blood tests to assess the other functions, like for cardiac diseases, for the lungs, for the liver, all other metabolic functions. But I would also like to emphasize the adult immunization. We should not focus only to COVID-19 vaccination. We have still the flu vaccine, the HPV vaccine, the pneumococcal vaccine. We really have to emphasize also on adult vaccination.
Now, Ms. Natsi, comparing the Philippines with other countries in the world, what do you think are some of the biggest challenges that Filipinas face here in our country when it comes to equality at home, in the workplace, and especially, of course, the biases?
If you look at the latest Global Gender Gap Report for 2022, our lowest scores were in political empowerment and economic participation and opportunity. Yung health and survival, educational attainment, good tayo eh.
Dr. Irene, what advice could you give women, especially when it comes to their mental health, to be able to find a good medium ground when it comes to the pressures that society gives to them, but at the same time, still having time to recognize themselves?
In the past 2 years, we have realized the importance of self-care, especially for women. So number one thing is for us to enhance our spirituality and sense of gratitude. Secondly, you have to stay positive. You have to declutter your life with issues that are negative, with relationship that does not give you joy, or any endeavors that does not give you joy. It's like decluttering your life. You can do the exercise, yoga, meditation, anything that will relax you and will give you joy. You can go into learn some arts and music. You can play the piano, painting. Approach your physical and well-being holistically.
Now, of course, self-care also involves daily practices that make us feel nourished and happy. Ms. Natsi, what are some ways that women can cultivate self-care in their everyday life?
I think what's important is the mindset. Is not to feel guilty. Because women tend to feel guilty when they do things for themselves, because they feel so responsible for so many people, in their lives. So start with that. Okay. So when you take time off for yourself to do what makes you happy or what gives you pleasure, yung sinasabi nga ni Doc Irene, what gives you joy, then you should see it as something that you owe to yourself because of the work that you do on a regular basis. So we need to make space. It's something that you really need to do for yourself because you want to be able to continue to care for others. And in order to do that, you need to look after yourself. So yeah, find whatever makes you happy, do it, don't feel guilty, and make it a daily practice.
But before we go, I'd like to ask Ms. Natsi if you have any message for all the women out there.
I want to greet everyone a happy National Women's Month and exhort all the women in the Philippines to please love yourself. Okay, so take care of yourself and remember that we need to look after ourselves in order to look after others.
Very well said. And Dr. Irene, do you have any message for our viewers, especially when it comes to women's health?
If we have emotional quotient, we should have health intelligence or health quotient. This is being able to assess, perceive, and manage your health. You should educate yourself, conscious of your physical well-being by doing the proper attitude, avoid harmful habits like smoking, and alcoholic misuse. And you have to consult your family doctor or your OB gynecologist because you will not enjoy the fruits of your labor if you are always getting sick, if you're not healthy.
With that, I'd like to thank obstetrician gynecologist Dr. Irene Sige and Director of UPCWGS, Director Dr. Natalie Africa Verceles, for being with us today and sharing your insights. We appreciate your time very much. Remember, we all play a role in breaking the bias today. So let's celebrate women's achievement and together forge a gender-equal world. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk on CNN Philippines. We'll see you again next time.